From the campus of the University of Nebraska at Omaha, consider this with Cathy Wyatt, a program of issues and information behind today's news.
UNO and UNMC are launching a mobile game to teach kids and teenagers about public health. Players have to survive waves of infectious diseases while answering quiz questions designed to teach the player about real-world knowledge, everything from the bird flu to measles to hygiene.
Hi everyone, I'm Cathy Wyatt. Welcome to the 29th season and this week's edition of Consider This. Our topic, Zoodemic. Joining us to talk more about it are Alexandra Todd, health policy analyst with UNMC's College of Public Health, Deepak Khazanchi, professor and Mutual of Omaha Distinguished Chair of ISNT and Executive Director of UNO's Center for Management of IT, and Jade Busek. Jade is a student at UNO majoring in bioinformatics. Thank you all so much for being here and welcome.
Thank you.
Thanks for having us.
All right, Alex, I want to start with you.
Yes.
How do you define public health?
Yeah, public health is really broad. It's basically everything, which I know that sounds like a tall order, but public health is essentially where we work, where we play, where we live, where you go to the gym, where you walk your dog, get groceries. It really encompasses everything, which I think is one of the beautiful things about public health.
Yeah, key aspects of it.
Yeah, so key aspects of public health is it's primarily, trying to see things in our community that we want to improve upon. So a lot of it comes from noticing a need and then perhaps writing a policy or deploying an intervention to help solve that problem, and then also following up on it to see how it affects our community and if it affected it in the way that we really wanted it to. So one of the, also I would say, cornerstones of public health is what we call determinants of public health. So those are factors that people experience every day that impact their quality of life. So it can be things that we don't often think about. So like whether or not you have a grocery store within walking distance, if that food is healthy, if you live near a green space, things like that. So public health really tries to meet people where they're at and to improve their lives, no matter where they were born into.
So what are some of the concerns regarding public health in Nebraska, especially this time of year?
Sure. Well, I think any parent of any small child right now, I think, can probably tell you that like flu, RSV is at the top of everyone's minds right now. I think we're coming off of a particularly nasty flu season, and we've kind of seen the data to back that up. So we actually met a kind of somber milestone in February where we saw the first pediatric death in Nebraska due to flu. So things like that, we're looking at flu, we're seeing diseases that were previously eradicated. So like measles was formerly eradicated in 2000, but now we're seeing it pop up everywhere, including Nebraska. I think we've had about 3 in 2026, and we're also detecting things like poliovirus in our wastewater. So there's some emerging diseases. There's definitely room for improvement when we were looking at things like vaccines, which you can talk about, but kind of in that same vein, we're seeing that flu vaccination is approximately 46% of adults and slightly more for kids. But like I said, it can be very serious this time of year.
So kids, obviously one of the most vulnerable populations, but also one of the most difficult to reach. Talk about that a little bit. Yeah.
So when we're looking at kids, they are particularly vulnerable in a couple different areas. Number one, their age group. So a lot of kids, under 6 months can be particularly vulnerable to things like flu and respiratory diseases that can hit pretty hard, which is why the CDC recommends flu vaccinations for anyone over the age of 6 months. And then additionally, they're particularly vulnerable because they're going to school, they're going to daycare, so there's a lot of things spreading. And then in terms of reaching those populations, I feel like a lot of public health guidance reaches a more mature audience, so it's not always targeted towards youth, which is why I'm so excited to be here talking to you today. So when we're looking at kids and we're looking at communicating with kids, public health communication is essential, that you tailor it to the population, you know, that you're addressing, that you're trying to work with, because everyone has different needs. So when you're looking at kids, you need to present accurate health information, but still in a very engaging, accessible way, so they understand what's going on, and that you can kind of also keep their interest locked in a little bit.
Deepak, what a great segue into you that she just made here. Before we talk about this app, tell us the story behind the name Zoodemic.
Sure. So the original idea came from Dr. Khan, who's the Dean of College of Public Health, who wanted to address this issue of, this was the time during COVID in late 2020, early 21, and he was trying to engage us to see if we could build something that would apply to educating young kids. And so we said, well, okay, we're trying to design a game, and one of the things that at that time we were learning is that a lot of diseases, the term that actually encompasses this is zoonetics, which is basically the idea that a lot of germs and disease might spread from animals to human beings. And there was all this story about COVID before that. So we decided that it was a pandemic that we were coming out of, and zoonetics, so that's why we named it Zoodemic.
Do me a favor, when you talk about the we, right? Who is that?
So it's a group of students who work in my lab. At that time, we had a bunch of different students working on app development and websites for nonprofits and even medical intervention studies. We would build the apps that would be used by behavioral researchers in the nursing school at UNMC or in the public health area. Okay. So this was a group of people that are trained in our college, but also are trained in the lab to kind of build applications for solving these kind of problems.
Okay, thank you. So when we talk about Zoodemic and you have to sum it up, what is this app? How do you do that? How do you sum it up?
So I would say that if I were to quickly sum it up, it would be that it's a game, a serious game. Some people call it serious games, which is basically a game that is educational while you're having some fun. So the idea is to teach the public health concepts that Alex was talking about, also encouraging people to go explore more information about those things while also having fun playing an interactive game. So that's what I would describe it as.
So I would imagine, and I don't want to assume anything here, but you had fun putting this together,
Absolutely.
Right?
Absolutely. The amazing thing is we had a high school intern, we had college kids all working together to kind of understand what the public health issue was, and then how do they relate it to young people of their same age group. So it was actually a very nice mix of collaboration between all these areas.
Yeah, it is a point that I really want to drive home to our viewers. This is students helping other students.
Yes.
Just different age groups, and who better to try to relate, right, with this cohort than people who've kind of just been there, right?
Exactly.
Yeah, so I love that. All right, now, Alex, you have your phone here. Permission to use the phone during the interview. I just want to let viewers know she's got permission. She's going to actually walk us through how this app works. So go ahead and pick that up there.
Okay, so I'm going to try to talk through this. No one can judge my playing skills, okay?
That's all right.
So we open the Zoodemic main screen, so we see some options here. So there's play, instructions, credits, private policy. So we're gonna click play, and so this is Zoodemic 2.0 that we have re-released this year. But see, we have a map progression here, and each of these levels is something different. So if we click here, this is gonna kind of start with the basics of germs and zoonoses, which we talked about is when germs spread from animal to people. And then as you defeat that level, you can then move on to all these different levels. So how germs spread, germ protection, this one specifically on zoonoses. And then over here we have more, I guess, topical topics. So we have bird flu and measles. So we're actually quite excited because one of the features of this game is we can push out levels based on new emerging diseases that people want to know about. So when we open the game, it looks like this. So you get different points for, I guess, how well you perform. I might not get any points, but we're gonna try this. So you're this little syringe here. So you go and you kind of shoot, you usually shoot viruses, but so it's gonna say what type of zoonoses are Salmonella and E. coli. So we're going to say that it is a virus. And so when it's incorrect, it shows you why it's incorrect and what the correct answer is. So then you click close and then you try again. So now you're shooting your viruses. And so what I ran into there was a power up. So you can also get different things throughout this game that make it more engaging. So what are emerging diseases? So let's try H5N1. So again, it would tell you what an emerging disease is and give you a little explanation. And this is primarily, for kids who want to know more about it, but the language is it's designed to be more accessible. So anyway, so you're shooting, and so up in the upper left-hand corner, you have your lives, and then on the top, it shows you how much ammo you have, which you can get. You can shoot packs of ammo when you're low on ammo, and then it'll show you your high score. So then anyway, so when you
can lose your life too?
Yes, and you can lose your life, which I'm incredulous I haven't managed to do yet. But anyway, and then you can also gain extra lives. So that's kind of what it looks like.
Okay.
And they pull from a bank of questions, and it kind of just filters out through that question.
So I have to ask, what
course.
kind of feedback have you gotten from that target audience, or have you made a concerted effort to go out there and talk to people yet? Where are we in that process?
Sure. So kind of like I was discussing a little bit already, and I'm sure Dr. Khazanchi will talk about it kind of in the future. Zoodemic has been around for a couple years, but this is now Zoodemic 2.0. So we have implemented a couple really exciting changes with the help of NebDev, which I did want to give them a shout out as we're talking about a lot of this being student run, is they were students at UNO, but they are now in Omaha. So this collaboration is very local, which I think we're all really proud of. So the feedback that we've all gotten has been overwhelmingly positive, but we are constantly trying to find ways to update the game, make it easier to play, make gameplay easier. So we actually still have exciting updates like locked and loaded in the pipeline that we're hoping that NebDev is going to have go live in a couple weeks.
Jade, as you are, and welcome, as you are watching all of this, while you were not directly involved in this, you are a student and you have been involved in other projects. And I think this would be a good time to let our viewers know, outside of Zoodemic, what other types of things are going on where you are that are eventually are impacting or eventually going to impact the community. So first, let's start off by asking you a little bit about yourself. What's important to know about you?
Yeah, so I'm a junior here at UNO. I'm a bioinformatics major, which bioinformatics is a very unique combination of things. It's data analysis, a little bit of statistics, but then it's also biology and chemistry. So you're kind of combining those life science type sciences along with the data science. So you're able to analyze those health sciences, zoonotic type things, and you can create very interesting outcomes with those things.
Okay, so I have to ask, as someone who is not a lover of my science classes, why this path for you?
I think growing up, my dad was a software engineer and I was always very interested in the computer science, but I didn't want to code all day. So I wanted something that really grasped my attention, and I liked healthcare, but I didn't like blood. So I was like, what can I do to combine those two things? And that opened up to my eyes to a whole new world of there's so many degrees and different fields like bioinformatics where you can do the back end work and help support the people like Alex who do the more public health analysis things, a lot of the back end type of things. Yeah.
Okay, no, very good. So what types of projects have you had an opportunity to team up with others on then?
Currently, we're working on a predictive model in diabetic readmission in the UNO ATIC, CMIT, under Dr. Khazanchi. We're utilizing AI and predictive modeling to help develop a model that would more accurately predict diabetic readmission. So that's currently a massive problem. Usually about 30 days or before 30 days, people are readmitted for diabetes, and there's a massive data set that's publicly available. So our goal is to try and utilize that data set to accurately repredict that, but also we want to do that fairly. So how can we make it ethical? How can we do it fairly using AI? Because that's something that's kind of doesn't really have guardrails right now. It's kind of a little bit of a free-for-all, for lack of a better way to explain it. So we want to do that, but also still make sure that everyone is included in this type of model, in this type of new product we want to put out.
Okay, Deepak, talk a little bit about what it is like to work with students such as Jade, who are, engaged in what's going on here and really wanting to be a participant and make a difference, right? Not just in the present, but in the future as well. I mean, that's got to be beyond a feel good for you, right? I mean, in terms of making a difference.
Absolutely. I mean, it's a privilege actually, because for me the best part of all of this is that I get to work with. Right now, I have 13 undergrads working with me. So it's amazing that all these kids want to do what we are doing, both in the community and in the lab, because I have all kinds of projects, including community work, and they're all paid to do the work, because one of the things I want is to have them feel responsible for the products they are building. But the other is that they really want to do it. So I think there are two different things here at play. And plus, I think I feel that every student should get some experience doing research or doing, in technology, building something, so that they can see how it actually works. Because I think just merely being users of technology is not enough. And I think that's really what makes me come to school every day. And other than teaching my classes, I love the fact that I can talk to these young people and even learn from them in many ways.
Well, and I was just going to ask that, because you are the teacher, right, the educator, but there has to be learning on both sides here. So what would you believe to be the greatest thing that you have learned from someone like Jade and her classmates?
Well, Jade's a special person. I mean, she's very organized. She actually organized my life in many ways, because we had this program for girls called Code Crush, which was launched in 2012, 2013, much before anyone was doing any girls programs. And Jade was a sophomore, I think, and she was trying to find out what kind of work can she do. I said, well, why don't you run my program for me? So she actually ran this Code Crush program essentially, and it's statewide and in Iowa. So she was actually coordinating all of it. And it's amazing to see how thoughtful and comfortable students are, like Jade, in working with the community and bringing them in for these kind of outreach programs that I've had going for many years. But I have to actually find a student like her every 2-3 years after they graduate to help me run those programs. So
yeah. So Jade, what have you learned from your classmates? I mean, you're all you're working on really important stuff, right? And a community service to boot. So what is it that you're learning from each other? You're going to walk away from UNO at some point with what, having worked with them?
I mean, we have such a multidisciplinary team. We work with education, we work with engineering, we work with software engineers and people who specialize in AI, but I think the biggest thing I've learned is empathy. Like, every project we work on, every problem we are given, it's always, and I think Dr. Khazanchi plays the biggest part in this, but how do we make it fair? How do we make this work for the most people? How do we make it, how do we make sure everyone is included in our end product, so that way it benefits our community and no one is left out? And I think that is really powerful. And even with Code Crush, oh my gosh, he saw a massive gap in, he saw a huge gap in young women like me who are interested in computer science and these STEM-based things, and it was not being filled. And now because of it, we've had thousands of young girls who have pursued massive paths in these fields because of him. And so, sorry, but it's just really powerful to see, and it's just an amazing place to work and learn from.
You know, Deepak, I'm listening to her and I'm thinking just
Sorry.
the value of inclusion, the value of collaborative spirit, the value of just making sure that you are checking from time to time the why. Why are we doing what we're doing, and how is it that I am able to make sure that the students understand the significance? That's very powerful testimony coming from her, and I wonder how that makes somebody like you, who gets up every day, right, goes to work like the rest of us, but that's something.
Yes, I mean, I think that, I'm very proud of Jade. The thing is that, if you have a passion, I think, it makes it, and in my case, it's been, how can I use my energy and my skills to make a difference in any way I can. I have to write grants to get funded to do the work, but I think it's so important that the work be done. And even if it's one person at a time, I'm willing to do it. I mean, that's really how I think of it. And Jade worked for me for a whole year before. Now she's working a little bit more at UNMC, in fact, doing cancer research. So she hasn't talked about that, but that, to me, that's amazing. I mean, I have a student who came all the way from Oak Brook, Nebraska, I think, and it's on the border of Colorado, I believe, and she's now a medical student. So I mean, that makes a difference to me. So I mean, I think, it's not just taking care of ourselves, but taking care of these, small wins make you, really feel good about life. I mean, there's so many other things that are going differently around the world, but this is it. This is what makes a difference.
So, Alex, I'll give them just a minute to breathe here. This
Yes,
whole collaboration is a word that we brought up a lot, especially during COVID. At that time, it was more important than ever for people to be coming together. So, being a part of UNMC, part of UNO, talk to us a little bit about the significance. I mean, we're hearing about this crossover, which is really, really cool, right? That's what you're after. What have you seen as a result? Specifically, we're talking about Zoodemic today. So what have you seen that maybe you weren't quite as aware of before this partnership took off?
Sure. I think I was not aware of how many people had Zoodemic come across their boards, I guess. I did not realize how big of a collaboration it was. I was brought on kind of, I feel like right after it was maybe initially published, but now I'm kind of overseeing it. So the way that it started, as Dr. Khazanchi talked about, was my mentor and champion for public health, Dean Ali Khan, who you've had on the show previously, came up with this idea, and then he reached out, probably roped Dr. Khazanchi into it, and then we have also had people.
You wanted me to do it free for I did do it free.
Well, we talk about things like passion, right? And that's what it's all about. And so then we had the NU Foundation come in, and one thing that I learned was really cool. I don't know if anyone knows about this app, but it's called Plague Inc., and it's on your phone. I think it's maybe in a bunch of other little mediums too, but this guy by the name of James Vaughn made it, and it's hugely popular app that you essentially are a virus, and you pick characteristics of the virus and you play it out on your phone, and you see how that spreads, which is now very pertinent to what we all went through in 2020. But he actually was an early contributor and donor to Zoodemic. So that was amazing to know. So big shout out to him. But then in addition, so the way that I think really kicked off Zoodemic was the CDC gave states a grant to create information or informative material for this kid's demographic on zoonotic diseases and how we interact with our environment and also animals, which is called One Health, if anyone is curious. But that's really how we kind of ratcheted up. And so now we're moving on to this next phase of Zoodemic 2.0 with NebDev, who have been tremendous in coming up with updates. So that's kind of how the funding came to be.
Wow, talking about Zoodemic today, we have just a few minutes left. Deepak, what's next for you? What are the wheels turning and thinking about now?
Well, we are working on right now it's just experimental, but we are working on a bot, an AI agent that will help people understand and be nudged to do colon cancer screening at an earlier age. Because now most people think that it should be started at 40. So I'm working with a faculty at the Public Health College, Dr. Watanabe, and she and I are essentially we have just submitted a proposal to build this thing called Colobot, basically, which will be available to people to use once we do some clinical testing. And that is to help them kind of be self-aware of when they should get screening.
Okay, thank you. Jade, we have like a minute, less than a minute remaining. Where are we going to find you in 10 years?
Hopefully still doing research. I hope to go to grad school, so continue my education and hopefully continue to contribute to the community.
Okay, thank you very much. We are talking about Zoodemic today with Alex, Deepak, and Jade. We're going to put up a couple of websites for our viewers in case they're wanting more information about this. All right, so we have UNMC.edu, of course, 402-559-4000, then UNOmaha.edu, 402-554-2380, and you can find this app, Zoodemic, available on Apple App Store and Google Play. I actually said that like I knew what I was talking about, which is really impressive. I want to thank all of you for being here and sharing your time and expertise. And honestly, best wishes to all of you as you move forward. Thank you so much.
Thank you so much.
Thanks to our students who are working so hard behind the scenes, and of course, to all of you for watching. We will see you next week.
Consider This is an issues and information program produced by UNO Television in the School of Communication. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call the UNO School of Communication at 402-554-2600 during regular business hours. Or send an email to cwyatt@unomaha.edu.